Good morning, everyone. Thanks for joining us. My name is Leslie Dock. I'm the chair and founder of Protect Our Care. We're here today to celebrate the Affordable Care Act and what it's meant for millions of Americans, and to recognize the one single individual without whom we would not have an Affordable Care Act, and that is Speaker Nancy Pelosi. Today's the 13th anniversary of the ACA, and it is a bill that has made a tremendous difference in the lives of so many people. Because of the Affordable Care Act, people with pre-existing conditions don't have to worry anymore about whether they can get covered. People have no more lifetime caps on their insurance. Millions are covered by Medicaid. Tens of millions have health insurance they can now afford. And millions more rely on the ACA for free preventative services like cancer screening and mental health screening to keep them healthy. People know how arduous the struggle it was to pass this law. But what people may not know is the critical and essential and important role that Speaker Pelosi played in making this a reality. Her legislative acumen, her tenaciousness, her vision were all responsible for a law that makes such a difference in the lives of so many today. But the Speaker also taught us an invaluable lesson, which is it doesn't matter what people like me who trod the halls of Congress do. What matters is the grassroots. What matters are the people who have stories to tell, whose lives are benefited, whose lives are improved, who take their own time to tell those stories far and wide, and are willing to, in a sense, open up their own privacy, their own family stories, so that others can understand just how important this is. And no one has been a greater voice of the grassroots and a greater voice for making sure that people who are helped have an opportunity to share the need and the solution. And so we thank her. All of us have learned that political lesson from her. Before I hand the microphone over to the Speaker, I just want to introduce Adam Hoyer, who's sitting right in front of me, who's our National Organizing Director at Protect Our Care, who, for most of his professional life, has been working with folks around the country to help them tell their stories. And he's going to moderate our discussion with the Speaker today. So with that, I just want to introduce who we all believe and know is the greatest Speaker in the House we've ever had, the person to whom we owe our healthcare system today, and by the way, not just the Affordable Care Act, but also the drug provisions in the Inflation Reduction Act. We would not have those today if it wasn't for her work. So it's an honor and it's a pleasure to be here and to listen to this conversation we're about to have. Thank you.
Thank you very much, Leslie, for your very kind words, which I accept on behalf of all of the House Democrats who were so courageous to make this vote, to make this fight, and to, as we celebrate this, I want to celebrate them. But I also associate myself with your remarks about the outside. Our inside maneuvering will only take us so far. It was the outside mobilization that got us over the top. And I join you in celebrating the great mobilization that took place, not just to pass the legislation, but also to save it. When Adam and you and others, Protect Our Care, organized 10,000 meetings across the country, 10,000 events across the country where people told their stories. So our VIPs in all of this are our volunteers in policy, our volunteers in politics, to tell the stories that make the difference in the lives of the American people. So this anniversary is an anniversary of the happiest day of my official life because of what it means for people. Dr. Martin Luther King said, of all of the inequalities, the most inhuman is that of inequality in healthcare because people could die. This legislation saved lives that would not have happened without the work of our grassroots. You've heard me tell the story that when the press said to me, "You're never going to get this done. How are you going to get it done?" I said, "We're going to go through. If there's a gate, something in our way, we'll go through the gate. If the gate doesn't open, we'll climb the fence. If that doesn't work, we'll pole vault in. If that doesn't work, we'll parachute in." And then they said, well, what did you do once we passed it? Well, we pushed open the gate, and we could only push open the gate with our grassroots. It was our members, yes, but it was our grassroots. It was the nuns, it was Addie Barker and the Little Loves, all of the people who had understood the difference that this would make. And of course, Protect Our Care was essential to all of this. So I pay tribute back to you, Leslie, and to Adam, and to all at Protect Our Care, and all of the people you brought together. And with that, I want to yield, I'm going to yield back to Adam. Adam, thank you for your tremendous, relentless, persistent leadership in making, not only having this passed, but to save it when it was under assault from those who would repeal and replace. They didn't either. Thank you.
Thank you, Speaker Pelosi. It's surreal to be sitting next to you as we commemorate the anniversary of the Affordable Care Act. You're a hero, you're a fighter, and it's just a thrill to be in a room full of heroes and fighters on healthcare. It's hard to believe it's been 13 years. It feels so long ago. The ACA is a teenager now. And I think, when I think about, and Amy and I were talking about this morning, it's easy to forget what it was like before the Affordable Care Act, before those protections were in place, before healthcare was much more accessible and affordable than it is now. We have work to do, and we're doing that work. You're doing that work. Thank you for that. But for me, the thing that encapsulates the last 13 years of the Affordable Care Act is that it has been a fight. It was a fight to pass it, and it's those of us who've worked in healthcare know how impossible it was to take on the insurance companies, and you did it and you won. And then the fight to implement it, and fighting against all the disinformation and the attacks and the outright lies about death panels and socialized medicine, fighting against that to get it passed and implemented and into people's homes. But then the fight to repeal is where I met a lot of these people too. Because, it was so quick on the other side for Republicans to want to rip away people's health care. And it took people sharing their experience, telling them exactly what that would mean for them, for their families, for their children, for our future. And this is why we defeated repeal then. And now the fight goes on to build on it. And so, like I said, I think this is so appropriate. I'm so thrilled that you convened this roundtable of folks who are able to share their stories about how the Affordable Care Act impacted them. Because again, I remember before the protections were in place for people who had cancer, when that would be a pre-existing condition that was just uninsurable, for people whose children had a transplant and now are no longer subject to lifetime caps. Being able to stay on your parents' insurance until you're 26 was so enormous in getting young people who thought they were invincible, getting them covered, and a whole host of other experiences. And so it's a thrill. One of my best friends now, thanks to trying to fight back against repeal, is Elena Hung, and her wonderful daughter Jamara were instrumental in the fight against repeal in 2017. I think that's probably when we first met.
Yes.
You and the little lobbyist. And you're someone who doesn't need an introduction when it comes to the ACA, but it is my pleasure to introduce Elena Hung from Little Lobbyists.
Thank you. It is a thrill to be here. Hello, Speaker. I am so excited to be celebrating 13 years of the ACA, and I've said this before, and I will say it for the rest of my days. It is no exaggeration that my daughter, Xiomara, the joy of my life, and countless children with complex medical needs and disabilities like her are alive today because of the ACA. And I have to say this, Speaker, we have the ACA because of you, because of your leadership and your commitment. I supported the passage of the ACA 13 years ago, but I have to say I didn't fully understand and fully come to appreciate the ACA until a few years later. In 2014, I had a great pregnancy and an amazing birth. And then 15 minutes after my baby was born, she was placed on 100% oxygen support and rushed to the neonatal intensive care unit, where she remained for the next 5 months of her life. She was diagnosed with serious medical conditions affecting her airway, lungs, heart, and kidneys. She uses a tracheostomy to breathe, a ventilator for additional respiratory support, a feeding tube for all of her nutrition, and a wheelchair to get around and explore the world around her. But she is alive and has a wonderful quality of life. She is rambunctious and naughty and causing good trouble. And she has all that because of the ACA. And we often forget that the ACA, we call it the Affordable Care Act, but we often forget that it's Patient Protection and Affordable Care Act. It protects us. And I often think of all the babies like Xiomara who are in the neonatal intensive care unit and whose 5 months in the NICU total $3 million in medical costs, and who now have a chance at childhood because the ACA banned lifetime limits on their care. The ACA protects these babies from being denied medical care. And I often think about all the children like Xiomara, whose medical history is a long, long, long list of medical diagnoses and medical procedures and an extensive care plan, and who now have a chance to grow up because the ACA does not discriminate against pre-existing conditions. The ACA protects these children from being denied health care. And it's not just children, it's everyone. It's all of us. It's here to protect us. Xiomara's 8 years old now. That is 8 birthdays that were never promised to a medically complex child like her. She is currently on dialysis for her kidney disease, and she's awaiting a life-saving transplant surgery. And I am comforted to know that she has and will have the health care she needs because of the protections of the ACA. So that is what the ACA means to me and to families like mine, that we give our children a chance at childhood, a chance to grow up, and that we get to celebrate more birthdays with them. All right, so, and if celebrating more birthdays isn't what we're fighting for day in and day out, then I don't know what the heck we're doing. So today we celebrate the passage of the ACA 13 years ago. We celebrate our success in defending and protecting the ACA every year since then, especially in 2017. And I look forward to all the days when we celebrate expanding and improving the ACA.
Beautiful. One of these days, Xiomara is going to be here testifying.
That's right.
Can you see that, Adam?
I can't believe the ACA is 13. I cannot believe Xiomara is 8.
She's been a joy.
Yeah.
Yes, indeed.
Absolutely. And I mentioned fighters, and there's no better or greater fighter than Xiomara. And thank you for your advocacy. And I remember our fights against repeal in 2017. And Naomi, your own fight first against cancer, and then against all of the repeal attempts. Since then, I remember fighting with you, I guess, since 2018, probably somewhere around there. Could you share more about your experience on both your own healthcare and your own advocacy?
Yeah, my professional life, I've studied healthcare and healthcare policy and healthcare management. So on paper, the ACA, had strengths and weaknesses, and I could sort of objectively look at it and see its potential. And then in 2017, I was on a work phone call, and anybody who's gotten that call remembers that visceral feeling that, I'm on a call and it's blah, 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 carcinoma. And just everything sort of fades out to gray around you, and you feel like, at least I felt like I was hit with this wave and couldn't quite breathe. And so you go through the process of the diagnosis and the treatment plan. And for me, it wasn't as extreme because I was a stage 0. I was diagnosed in July. I had mastectomy in September, and the cancer was gone in that short period of time. However, complications and infection, things that happen that you have the follow-up. So my bills over the course of the first year were probably $1 million. And I'm thinking, great, this is covered. And I'm watching the stacks of bills come in, and I remember vividly laying on the couch thinking, oh my gosh, how am I gonna pay for this? What if I went back to school. What if I can't get insurance? What do I do about my children? Is it better? So all these decisions that everyday people, do I take my full dose of insulin? All these trade-offs that we make in our heads. And I was protected. And honestly, I thought of you. So I was like, Nancy's got my back. And this will protect me and it'll give me flexibility. And then in 18, when it was under attack, that visceral feeling came right back of, oh my God, what does my tomorrow look like? And so, again, I'm not an extreme case. My children have celiac disease, which is very manageable, but we couldn't, you can't transfer insurance before. I would have maxed out my lifetime limits. I would have had to make choices over mortgage or healthcare. And so the ACA has become such an integral part of life that we take for granted, but it's not only saved lives, it's saved bankruptcies, it's saved, ability to change jobs. It's so much of us becoming healthier. And then, on the other side, being a researcher, seeing people are getting healthier. I mean, it's not just I'm saving your life at this extreme end. It's people are taking care of their diabetes. People are taking care of their heart disease. All of these things are happening because the ACA is in place saying you're covered for basic care. You're covered for extreme care. You're covered, your insurance has to do these things so you're not surprised that, wait, that wasn't covered. How am I going to pay for that? So all these little elements that I think have become part and parcel, those of us who've sort of lived through you can feel it. It's the part of the struggle. So thank you, because in all honesty, you were sort of the backstop at times where I want to focus on getting better. I want to focus on my mental health. I want to focus on my children and my family and my future, not the 4-inch stack of bills and the, oh my God, how am I going to pay just to have another birthday? So that's why I became an advocate. I really, really greatly appreciate the opportunity.
What a story. That stress is such an important element in getting well, not having the stress of all of this. And as you speak it, you can just feel that weighing in or not.
Right. How do you focus your energy on your body and getting well if you're worried that you can't feed your kids? You can't.
Thank you.
The patient protections that you put in place in the ACA, as Amy said, it's easy to take them for granted now. It seems so common sense. It's hard to believe that just 13 years ago, insurance companies could just outright deny you because you had a pre-existing condition, or you fought and won your battle with cancer, and now you're uninsurable as a result, or it's just cost prohibitive. You mentioned stress, and that's a great word. It's to take that stress out of people's lives, out of families' lives. It's unconscionable that we ever lived through that, and that some Republicans want to take us back to it. It's reprehensible, but I'm so thankful that those protections, and they were so instrumental in the fight against repeal, putting people in front of their members of Congress to say, if you take these protections away, it is going to be devastating to me and my family. So to take on the insurance companies and win was momentous. It was a BFD, I think, as the president would say. And so, too, by the way, in the Inflation Reduction Act, taking on the pharmaceutical companies and winning, another BFD. But more on that, I think, in a little bit. Although Rena Hicks, who's here, she has both kind of an ACA tie-in as well as where we ought to go from here. It's you are diabetic, you rely on insulin, like so many millions of Americans. Thanks for being here and being able to kind of tell both stories, the ACA and IRA, and where we can go from here.
Yes, thank you so much for having me. Happy to be here. I was diagnosed with type 1 diabetes, which is also known as juvenile diabetes, in 2007. It was my third day of my freshman year of high school. And even though it's juvenile diabetes, that was actually kind of a late diagnosis for type 1. My family had no idea. I had no idea what type 1 diabetes was. I think I was like a lot of Americans where you kind of conflate the two types, and I was just diabetes. So it was a really big shock. I was in the intensive care unit for 9 days. I was a walking diabetic for about 3 months, so I went pretty much to the end that I possibly could have. And I think a lot of that was just, I was 13, it was the summer before high school, I was active, so all those kind of symptoms of like losing weight and stuff was just kind of, I don't know, lost in translation. But so I was in ICU for 7 days. My dad was on deployment at the time and got flown back. So on top of just having this life-changing diagnosis and a complete shift in how he was living, I was now having to deal with, oh gosh, what does this mean for our health insurance? I was, before that, an average healthy kid. So we're talking, your well visit every year. And so that was really scary. Thankfully, my dad at the time was in the Navy. So I had TRICARE, which was a great insurance program. But as I was creeping towards the end of high school, it was getting really scary for what my future was going to look like once I could no longer be on my dad's insurance. It was my junior year when the ACA became a reality. And I was so thankful because I was just recently talking to my dad and kind of like reflecting back on that time. And he was saying, like, I tried to not stress you out because you were in high school and you're a kid, but we were really worried and starting to make some serious financial decisions, and he was starting to put money to the side, thinking that we were going to have to pay out of pocket for a lot of not just my insulin, but all the supplies. I'm on an insulin pump. I have a continuous glucose monitor, so it goes far beyond insulin. But being able to be on my dad's insurance, especially through college and then after, allowed me to have a normal-ish life and make it so much easier to live in America with type 1 diabetes. I even think just my first job after college, is typically not the greatest pay, and you're kind of working for that experience. And I don't think I would have had that ability had the ACA not had passed, and I wasn't able to stay on my dad's insurance. Because it would have been a situation where I'm in an interview like, what's your health insurance like before? And having to kind of get a job for necessity and not for that experience or my passion and stuff that I wanted to do. So I thank you, because it really did allow me just to live an easier life with type 1 diabetes. I mean, we're talking the lifetime caps, me having a pre-existing condition that would have allowed insurance companies to choose whether or not to cover me. And again, this is a type 1 diabetes. There's no cure, but there's also no solid reasoning why you get it. So it just never made sense to me and felt really unfair, like as a kid, thinking, I didn't do anything to get type 1 diabetes. And even if you did, like, who deserves to live like this and to live so scared? So I'm excited for the ACA, excited where we can go from here. The Inflation Reduction Act, I think, was a huge success, and I'm just excited to see what comes as we build upon that. Expanding access, expanding the insulin caps past folks on Medicare, which Biden just announced. So I'm excited to hopefully see that getting some movement. But like I said, it goes beyond insulin. We have, insulin pump supplies, continuous glucose monitor supplies that definitely compete with insulin for those prices. So I just really appreciate all the work you've done, and I'm going to keep advocating and telling my story.
Wonderful. Thank you. That's great. Thank you. Thank you, Rena.
Yeah, and it's great now that, instead of having to fight against repeal all the time, now getting to fight to do more to build off the ACA so that Rena can tell her story in hopes of getting, a $35 universal cap.
Yes,
It's hard to believe that we're here now. It shouldn't be hard to believe. These are more common sense solutions that impact a lot of people with very relatable stories like Rena's. But it's so nice that we can finally build and expand on the Affordable Care Act. And North Carolina might expand Medicaid finally. Instead of having to go back, now we're fighting to go forward. And
My granddaughter Bella, 13, turning 14 today, so I'm identifying with your age right there, and what an assault on your well-being and getting that diagnosis was. But it's amazing to hear how many people in the country are affected by type 1 diabetes or diabetes in every other way, and all of the needs that are there. And your speaking out is so important, because we would like this to be completely nonpartisan. Unfortunately, we didn't get any Republican vote on even the Medicare piece of it. But I do think that there is hope there that they would come on board so that we could not only have the insulin, but everything else that goes with it in an affordable way. So thank you for sharing your story.
Yeah, I think a big lesson learned from the Affordable Care Act implementation as we kind of embark on, hopefully making drug costs more affordable, is those of us who worked in healthcare, I think, struggled to communicate to people what it would mean for their lives. And as we were taking misinformation from the right and lies, we were trying to tell a policy story, because those of us who work in health, we knew what a big deal it was to pass the Affordable Care Act. But it wasn't until we started putting faces
Stories.
and telling people stories that people started to understand who this would impact and how they'd be impacted. And I'm sorry to keep going to the repeal fight, but unfortunately it's what brought a lot of us together. But it wasn't until we were able to put constituents in front of their members. I remember we brought in a bus of West Virginians to meet with Joe Manchin. And I know, John McCain's ultimate thumbs down kind of stole the show the night of the skinny repeal vote. But, before that, we had Alaskans meeting with Senator Murkowski and Mainers meeting with Senator Collins. And thankfully, most of the Democrats were on board, so they didn't need too much convincing to not repeal the Affordable Care Act. But, Steve Gomez, who is a constituent of John McCain, it's weird seeing you here without your awesome son Anthony. But your story, it's one of the most compelling, and you've been telling it, I think, at least since 2016, and it's so compelling. I mean, would you share your experience with your son and what the ACA has meant to both of you?
Of course. First off, thank you so much for having me and for all of the work you've done with this, from the passage to protection. I mean, everybody said it, but I'll echo it again. I mean, without your work, I mean, there's a good chance that, I know Xiomara and Anthony, might not be here, or we'd be struggling a whole lot differently. But our pregnancy, for Anthony was normal, completely normal. And we didn't find out till about 24 hours after he was born that he had transposition of the greater arteries. So thankfully, we owe his life to a nurse named Haley Corbo, because coincidentally, her nephew had the same condition. So she saw it, recognized it, diagnosed it, and told the NICU at the hospital, this is what he has, call the cardiologist. It was Labor Day weekend. So nobody was there. And finally got somebody to come in, do an echo, get him out, and they flew him to Phoenix Children's Hospital, where they were supposed to do the switch procedure relatively quickly, giving him some time to get strong, and unfortunately the procedure didn't take. His heart didn't come back, so he was listed for transplant. And during COVID, the ECMO process was kind of brought to light a lot more, but the recommendation is to not be on ECMO any longer than 10 days, and he spent 3 weeks on ECMO. And it kept him alive. They got him to the point where he was 6 weeks old, and I remember exactly where I was. I was in the pharmacy at Fry's, and my wife called me and says, we got a heart. So literally dropped everything, went to the hospital, and he got a transplant. And he immediately turned pink. It was great. He was the color he was supposed to be, and everything was great, except the fact that because of ECMO, he lost all the digits on his left hand, everything but his thumb on his right hand, and most of his right foot, just necrosis. But we had him. We dealt with everything we needed to do, and we have him still. Our journey and our fight and our benefits from the ACA are innumerable. The first thing that brought us to this fight was the fact that he is a walking, talking, won't shut up, pre-existing condition. But the other part is the lifetime caps. My wife, because she doesn't throw anything away, happened to have an old insurance document from before we had kids and before the ACA. And she showed it to me, and she's like, that says $2 million individual lifetime cap based on this policy. He was 3.3 for the first 10 weeks of his life. So that'd be it. Cash it out. I mean, like Amy was saying, getting the EOBs, getting the bills. I mean, we were getting them in flat rate envelopes that were an inch thick every other day. I mean, so we're incredibly blessed that during that time we had health insurance. We had my wife's health insurance, and it was great because I know that having to foot $3.3 million would have put us under a bridge. I mean, we do well for ourselves in Gilbert. We do great. We work hard. We do well. But I don't have that kind of cash. And it's amazing to know that that's what it did for us, that's what it did for our family, was that he's not going to have to worry about getting coverage in the future. He's not going to have to worry about somebody capping his coverage down the line because on the condition that he didn't do anything, we didn't do anything, my wife didn't do anything bad during pregnancy. Everything was great, and he can move forward and he can live his life. I mean, he's amazing. He's 7 years old. He's bouncing off the walls. He can beat his brother in most video games. He can beat me in some of them, but he's doing great. He's looking to, he's on his therapies. He's dealing with his amputations, and his limitations just become gates that we got to open, gates that we got to knock down, and he knocks the hell out of them. He's trying to play soccer. He's talking about wrestling. So I mean, all of those birthdays, all of these opportunities are things that we owe to the ACA and to the work that you've done. And we really can't thank you enough. I mean, my wife and I had many a sleepless night as the Republicans started talking about the repeal piece. And without getting into too graphic language, it was very much, what are we going to do? Because I'm self-employed, I'm a contractor, and I don't have benefits. She had the benefits, and we were working through that, but we were still very much concerned, if they repeal this, what's gonna happen to us? And things we talked about, Amy brought up, bankruptcy and just financial ruin for a lot of people, and it's like, we're looking at this going, okay, I love you, but do we get divorced? Do we get divorced, and do we figure this out that way? I mean, we're fortunate that we do qualify for Medicaid. He's on Medicaid, and we try to use that as his secondary insurance. But we know that there's a lot of families that can't do that. We pay very high premiums for our ACA policies. We're now both self-employed, but we do that because we want to make sure that we're not abusing the system either. It's making sure his cardiologist, Phoenix Children's, his primary care, and all these doctors are still covered without having to sit there and make Medicaid foot the entire bill, which in Arizona, the Medicaid system is actually pretty good, and there's no questions asked. They take care of it, but we don't have to, so we don't want to, but we're very fortunate, unlike a lot of other families in Phoenix Children's and across the country that can't do that. And I know that we owe it. And I've seen hundreds, if not thousands, of families that I'm walking the halls of that hospital that I know are benefiting from the ACA and the 13 years of its protections. And we owe you more than we'd ever be able to say.
Well, Anthony's success is thank you enough for all of us, isn't it? And that's beautiful.
He wanted to come. He really did.
Did you bring a picture or anything?
I've got plenty of pictures.
See more, you got pictures, right? Yeah. Well, when you're speaking, you're reminding us that the expansion of Medicaid is a very important part of what is left to be done in many states in our country. I've heard stories like yours from people who have middle-income people. They're successful in their field and the rest, not endlessly wealthy, but are successful. But the Medicaid piece is still very important to them over and above any private insurance or ACA insurance that they have, and we're so proud that one of the improvements we had in the rescue package was to include many more people by lifting the cap as to how you could get subsidies. We have to make that permanent. We have to make Medicaid universally available. And people think of it as a low-income initiative only. It isn't that.
And that's what we did too. I felt that way. I very much played into the Hispanic bravado of, I can take care of my family. I don't need the help. There's nothing wrong with it. I mean,
No.
it was for his condition. It had nothing to do with that.
It's a universal benefit, and it certainly is a middle income, but for little children or for seniors on long-term health care. But thank you for sharing your story so generously.
And I'll say this about Steve too. Not only is he a great dad and a tremendous advocate, he'll tell his story whenever he thinks it can help the cause. And he'll jump on a plane, red eye, overnight just to be at a roundtable in DC the next day. And
Thank you.
Yeah.
Nap after this, but
Comes come straight from his son's track meet to be here with us, and it's a common story among people who are affected by the ACA, and it's been just a thrill to meet so many people who have been affected by
And
the
their
law.
courage and generosity of spirit to share their story in such an open way, whether it's about the children or feeding the children because of, again, the prohibitive cost of not having Affordable Care Act. So we're very excited about hearing your stories, because that's, as Adam said earlier, during that whole debate on repeal, we could have been talking about the provisions, but what's persuasive was the personal stories.
Right. And one other provision I think is worth mentioning in the ACA, preventive services being no cost to patients is such a big deal. Mammograms and cancer screenings, not having to pay that out of pocket is a big deal for me. In 2016, I found a cancer in my intestine. I would never have found it if it weren't for the no cost provision in the Affordable Care Act. I was young, I was cheap, I thought I was invincible, as you do. But that nagging kind of intestinal issue that I was having, when a gastroenterologist told me you ought to get it checked out for cancer, if it cost me whatever it would have cost before the Affordable Care Act, I probably would not have gone, but I did. And as of 2 months ago, I'm now in complete remission. So I don't know that
Oh my goodness, Adam has his own
So now I have my own story.
Your own story.
So thank you. And that's another thing that, of course, Republican attorneys general are now trying to take away through the Braidwood v. Becerra case. So trying to take us back to a time when we didn't have no cost preventive services. So we got to keep fighting against that as well.
It's hard to understand why they would not understand this in their own family, among friends, in their community. And it speaks to what Lincoln said, public sentiment is everything. With it, you can accomplish almost anything. Without it, practically nothing. So your stories into the mix evoke other stories. People were willing to tell their stories. And I can't even tell you how many people just come up to me in the airport or on the street or wherever to say, you saved my life, I had breast cancer, I had this, I had that. And that young people, they were invincible, but they were part of our lobbying effort to pass the bill, because one of them came in and said, I don't need anything, I'm 21 years old, and then had a very serious skateboard accident, and realized vulnerability, exposure is there no matter how young or healthy you think you are. So thank you for sharing your stories. We do have more work to do, and we learn from you as to what improvements can be made. And we learned from you, from all of that experience, what language worked with the people in your community communicating with members of Congress on it. Mm-hmm. And again, the more personal, the better. So thank you. It's pretty exciting.
I wanted to add, there's
Please,
two
Amy.
other elements that we we talked sort of about one, but building parity for mental and physical health into the ACA has been huge. And as we've seen people, increases in behavioral health issues and overdoses and the lack of resources on mental health, the push to parity has been incredibly helpful. I mean, even as somebody who's gone through a physical health, I needed the mental health support as well. Mm-hmm. And the ACA pushed for parity for that. The other piece, as a woman, as somebody, as reproductive rights are under attack, there's contraception in the ACA. You're guaranteed at least one of each form, which changed lives exponentially. Just having access to long-acting reversible contraception, which you couldn't before. You couldn't afford $1,000 to put, that in and of itself was an amazing accomplishment, and women should rejoice the fact that we have more choices, our health is more in our control, and the ACA protects that.
Well, thank you for mentioning that, and that was somewhat controversial. People, not that it was, but how it was misrepresented. Mm-hmm. I won't use the word lied, but how it was misrepresented. And again, one of the things that we're very proud of, in addition to everything you talked about, being a woman is no longer a pre-existing medical condition, because even beyond contraception, there were prohibitions. I myself, when I have 5 children, when I called about doing something about my back, they said, so I mentioned that I have 5 children. They said, how did we ever give you insurance in the first place? You shouldn't even have insurance. We shouldn't have had you. We didn't know you had 5 children. I had one since, we had gotten the insurance. So I was like, what?
Yeah.
What? I thought that was a sign of my strength, and you're calling it a sign of my weakness. In any event, thank you for sharing that, Amy. And thank you, Steve, sharing Anthony's story and your own and your wife. Please say hello. And of course, Amora, she rolls, I hope she meets Anthony one of these times. They can compare notes. And thank you so much for your story. But Adam, you're going to wrap us up?
Yeah, I want to thank each of you for being here. I know it wasn't easy to be here. We ought to get together more than once a year or every time. But here's the 13 years, the ACA, and here's to many more. And thank you, Madam Speaker, for commemorating the ACA with us, bringing us together, passing it along in the first place. Is there anything you'd like to say in closing?
Well, again, as I said before, this is the most exciting, important anniversary of my official life, the passage of this legislation, and a lot of our members were very courageous in what they did. But again, outside mobilization made our inside maneuvering successful. And so we always say our VIPs, our volunteers in policy and in politics, made it possible. Now we have to make it bipartisan, because we know that in the public utilization of the Affordable Care Act, it's nonpartisan, so it should be in terms of expanding opportunities that are there, starting with the Medicaid expansion in certain states. So thank you. And thank you all who are, the role that you all played and the difference that you all made. So thank you all so much. Congratulations and thank you.
I want to pop this up before they turn it off. She is a real life action hero. Have you seen this? Truly, I have Wonder Woman and I have Nancy Pelosi.
That is funny. Oh, what is that thing?
That's
A
your
mask. That's my mask. Thank you, Amy.
Well, now I want you to sign this one.
Okay, I'll sign it.
Well, thanks again. Same time next year? Or?
We'll just have to, in the meantime, keep working to make sure people know how important it is to expand Medicaid, how important it is to expand, to recognize beyond Medicare the insulin. There's beyond understanding to me why our members would vote against that. I'm not even talking about in the IRA. I'm talking about in a freestanding bill, overwhelmingly. The other side overwhelmingly voted against it. So we've got to get them hearing from their constituents.
Yeah, here.
Thank you for making that possible.
Thank you.
Thank you.
And let's salute President Obama and Vice President Biden for the role that they played.
Absolutely,
And
yes,
Harry
right.
Reid was so wonderful in all of this. Thank you.
Okay, I think that's us.
So will you sign
Thanks
this?
again.